Hello, my name is McKenna Whitlow and I am with
Brett Whitlow, and I consent to be recorded for video for this class.
So before the video started, I already washed my hands. I'm going to introduce myself to the patient. My name is McKenna. I'm going to be your nurse. I'm going to conduct a comprehensive physical assessment. We're going to start with the first domain, which is the head, ears, eyes, neck, and throat. First, some questions. Any blind spots or loss of peripheral vision?
No.
Any trouble hearing?
No.
Do you experience any frequent headaches?
No.
And then do you regularly get your eyes checked?
Yes.
Beautiful. So normally I would check for near and far vision. With the Snellen eye chart, I would have the patient stand 20 feet from the eye chart for far vision, have him cover one eye and read the smallest line that he can. I would have him repeat with the other eye. Since we do not have that chart, we will not be doing those two tests. We'll start with confrontation. So cover your right eye. I'll cover my left. Let me know when you see my finger by saying now.
No.
And then the other side.
No.
The patient says now when I see the finger as well, indicating no loss of peripheral vision. I'm going to check his conjunctiva and his sclera, see that he is moist and pink, he's free of any jaundice in the eyes. I'm going to do the pupillary light reactions with my pen light. When I apply the light, I see that the pupil I apply the light to constricts and that the other pupil also constricts. This is direct light reflex and the consensual light reflex. I also see that his corneal light reflex, that his cornea is in the same spot on each eye, which indicates symmetry. We're going to check for extraocular movements. I'm going to have you follow my finger with your eyes only. I'm looking for nystagmus or any other extraocular movements, and none are present. We're going to move on to the ear assessment. I'm looking at his external ears. I'm seeing that they are symmetrical bilaterally. He also has no swelling, thickening, any skin color changes. His skin color is the same as his face on his ears. He has no swelling, he has no tenderness, no discharge present. I'm going to do the whispered voice test, so face the other way. Cover your right ear. I'm going to stand 2 feet behind the patient, and I'm going to do 3 random numbers and letters.
B, 4, C.
Yep, and then the other ear.
D-O-2.
The patient is able to repeat the letters, so he has no loss of high frequency detection. We're going to move on to the nose and the mouth. The nose, I'm going to have you close your eyes and look up. I see that he has no deviation, that his mucus is moist, his mucous membranes are moist, and that the nasal cavity is patent. I palpate the frontal sinuses, and then I also palpate the maxillary sinuses. Any pain with this?
No.
The patient should feel the pressure of the touch, but no pain. The transillumination, I will ask you to open your mouth. I'll transilluminate the left sinus and the right, and they are equal in shape bilaterally. Could you smile? Good. So we see that his teeth appear healthy and maintained, which is a good indicator of overall health. His lips and his mucosal membranes are nice and pink and moist, which indicates good hydration. I'm gonna have you smile and say ah. Stick your tongue out. I see that Simpson's duct is opposite of the second molar. I also observe his pharynx, and I see that his tonsils are graded at a +1. They're visible, but they are not anything more than that. I'm going to have you stick your tongue out, turn to the right and to the left. We see that he has normal movement in his tongue. I palpate the head and the skull for any lumps, depressions, or protrusions. His skull feels bilaterally. He's free of all of those lumps, depressions, or protrusions. I inspect his neck. I palpate as well. We see that his trachea is not deviated. I'm going to have you put your chin up and swallow. And we see that his thyroid tissue moves up when he swallows, which is normal. I'm going to palpate the carotid arteries. We'll listen for bruits during the heart assessment. We're going to move on to the thorax assessment. Any cough?
No.
What about shortness of breath?
No.
And chest pain?
No.
Do you protect yourself from smoke exposure?
Yes.
Good. So I'm going to have you turn around. We're going to do the posterior chest first. I'm going to have you take some deep breaths. I'm just going to look at your overall symmetry. I'm going to palpate for any abnormalities, and none are present. We'll start with tactile fremitus. I'm going to have you say 99.
99.
And again.
99.
2 more times.
99.
All right. We hear that the fremitus is equal bilaterally. I'm also going to percuss. He has no abnormal dullness, especially in the bases during percussion. I'm going to listen to his breath sounds. Deep breath. Again. I hear that his lungs are clear. He has no wheezing or adventitious lung sounds. I'm going to ask you to say 99.
99.
Again.
99.
That is nice and soft and muffled. Checking for bronchophony. Can you whisper 99?
99.
One more time. That is almost inaudible when I'm checking for pector illiqui. And then I'm going to have you say E.
E.
Again.
E.
And this is audible,
E.
which is
E.
positive egophony. So I'm going to have you turn around. I'm going to inspect his interior chest. Take a deep breath. I'm looking for normal chest expansion. I'm going to have you say 99 again.
99.
And again.
99.
And I feel that his tactile fremitus is equal bilaterally on the front as well. And I'm going to auscultate his lung sounds on this side as well. And they're clear, free of wheezing and adventitious breath sounds. We'll move on to the cardiac assessment. Do you fatigue or tire easily?
No.
Go ahead and take your shirt off and lay down. Any swelling in the legs or feet?
No.
Any history of hypertension or obesity?
No.
And then do you regularly exercise?
Yes.
We're going to do the precordium assessment. I'm going to start by asking the patient to lie down, which we have done, and I'm going to locate the apical pulse by having him exhale and hold. The apical pulse is at the midclavicular line, and it's a short, gentle tap, which is present. I palpate at the apex and the left sternal border and the base. I feel no other pulsations or thrills present. I'm going to auscultate at all 5 sites, which is the aortic area, the pulmonic area, Erb's point, tricuspid area, and the mitral area. No adventitious heart sounds are heard, and I clearly hear S1 and S2. We look at his neck. He has no jugular vein distension present. I'm going to listen for carotid artery bruits, which are not present. We're going to move right into the abdominal assessment. Any abdominal pain?
No.
Nausea, vomiting?
No.
Are you on any medications?
No.
And do you follow a well-balanced diet?
Yes.
First, I'm inspecting the abdomen. I'm looking for his contour. His contour is a flat shape. I'm going to note that the abdomen is symmetrical, that his umbilicus is midline and even. I'm going to auscultate in all 4 quadrants for bowel sounds, which are present. They're not hyperactive nor hypoactive. I'm going to do percussion in all 4 bowel sounds. Tympany is predominant. There's dullness in areas with more dense organs like the liver. He has no shifting dullness, which would be density at the base of the abdomen. I'm going to lightly palpate for masses, tenderness, or rigidity. Do you have any tenderness?
No.
I would assess for rebound tenderness by pushing down with my hand away from any tenderness and quickly lifting up. The normal response would be no pain response. I also am going to test for Murphy's sign by doing deep palpation of the liver. So go ahead and take a deep breath. And I'm going to palpate the border of the liver. Any pain with this?
No.
And that is a negative Murphy sign. I would do the ileopsis test or the obturator test if we thought of appendicitis. So I'm going to have you raise your right leg, and I'm going to have you push down, and then I'm going to have you internally rotate your hip and then externally rotate. Any pain in the abdomen with this? I would next check, I'm going to have you sit up for costovertebral angle tenderness by placing my hand over the 12th rib and thumping my hand. Any pain?
No.
Okay. Which is negative for any tenderness. You can go ahead and put your shirt back on. We're going to move into the musculoskeletal system. Any joint pain?
No.
Any history of broken bones?
No.
Any problems with completing daily activities?
No.
And then do you perform muscle strengthening exercises?
Yes.
We'll start with inspection of palpation of the joints. So we would palpate the shoulders, the wrists, and the elbows. We're looking for any discoloration, deformity, any masses or temperature change. We also want to make sure that he is non-tender at all of his joint sites. Any tenderness?
No.
Good. We also can see that, excuse me, the epitrochlear node is located right here in the antecubital area. We're gonna do some muscle strength and range of motion exercises. First with your shoulders, I want you to hyperextend your arms. I want you to internally rotate, which would be your hands behind your back. And then external rotation, which is your hands behind your head. With your elbows, I wanna see if you can bend and straighten your arms. We're going to supinate and we're going to pronate. Beautiful. These are all normal. With his wrists, I'm going to palpate for his pulses. I want to see if you can do flexion, which is pointing your fingers down, hyperextension, fingers up. We're gonna do the Phelan test by having you place your wrists together and your fingers down. Normally we would do this for 60 seconds. Any pain?
No.
And then I also will do the Tinel test by percussing the median nerve in his wrist. Any pain?
No.
And this is testing for carpal tunnel syndrome, which is negative. I'm gonna have you stand up. We're gonna do a scoliosis test. I'm gonna have you bend down and touch your toes. We're seeing that the spine is straight and aligned with no curvature to the right or to the left. Go ahead and sit back. You can go ahead and lay down. We'll do some muscle strength and range of motion testing for your hips, your knees, and your feet. We're looking at the hip joints, the knee joints, and the ankles. Again, looking to make sure there's no discoloration, deformity, swelling, tenderness, or temperature changes. With your hips, you're first with your right leg. I want you to lift your leg straight up, internally rotate, external, put it down. Again, with the left leg. Beautiful. With his knee, I'm looking for extension, so bring your foot back. Awesome, and then bring it back down. Other one. Beautiful. We're looking at his knee joint specifically for the bulge and ballottement signs. Ballottement, we are going to push the knee up and hold and see that there's no extra fluid surrounding the knee. Ballottement, I'm going to stroke the knee and then tap the outer aspect, and we see that there's no fluid built up around the knees. With your ankle and foot, I'm going to palpate the pedal pulses. I want you to push against my hand and then push back. Beautiful. So all of his range of motion exercises were intact. We're going to have you sit up. I wanted to ask you if any history of tremors.
No.
What about seizures?
No.
Any problems with coordination?
No.
And are you exposed to lead or insecticides in the workplace?
No.
We're going to start with cranial nerve testing. Cranial nerve 2 we already did by confrontation. We saw that he had no visual field loss. Next we will check for cranial nerve 3, 4, and 6, which is checking for perola, seeing that his pupils are equally reactive to light and accommodation. He also had no extraocular movements when we did the 6 cardinal movements. So we know that those cranial nerves are intact. Cranial nerve 5 we're going to test by having you clench your teeth. I'm going to feel that the muscles are equally strong on both sides, which they are. Cranial nerve 7, I'm going to have you smile, frown, lift your eyebrows, and we see that he has symmetry and mobility with all of those muscles. Cranial nerve 8, we know is intact because he passed the whispered voice test. Cranial nerve 9 and 10, I'm going to ask the patient to say ah. And we see that the uvula and the soft palate rise. We also could elicit the gag reflex to check for this nerve, which we already know is intact. Cranial nerve 11, I'm going to have you push against my hand on your cheek, other side, and shrug your shoulders up. And we see that his strength is equally strong bilaterally. Finally, cranial nerve 12, I'm going to have you stick out your tongue. We see he has no tremors. And I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
His speech is clear, so we know that cranial nerve 12 is intact. I'm going to check for rapid alternating movements. I'm going to have you first pat your knees, turn your hands around and pat, and do this, back and forth. Faster. And we see that he is quick and rhythmic with his movements bilaterally, and you can stop that. I'm going to have you do the finger to nose test by closing your eyes and bring your finger to your nose. Do that with both hands. We see that he never misses when looking for his nose, and that he is accurate and smooth. I'm gonna have you next stand up. We're gonna do tandem walking. So heel to toe walking. We see that he is balanced and he walks straight while doing tandem walking. You can stop, you're gonna face forward, stand with your feet together and arms at your side, maintain posture and close your eyes. Normally we would do this for a full minute, but we see that he is balanced, he has no swaying, and he maintains his posture. And then I'm gonna have you keep your eyes closed and do pronate or drift. which is extending your arms out with your palms facing down. And we see that he also is able to maintain this position while doing so. You can go ahead and lay down for me. I'm going to check for heel to shin. So go ahead and alternate running your shin down your, your heel down your shin. We see he is able to do this bilaterally. And next I'm going to do some sensory exercises. So I'm gonna have you close your eyes. I have a toothpick right here. I want you to tell me when you feel the toothpick on your foot.
Yes.
Is it a sharp pain?
Yes.
What about on this side?
Yes.
Perfect. If I had a tuning fork, I would check for his vibration, check for his sense of vibration on his distal areas, such as his feet. If it was felt normally, a bilateral, that would be a normal response. I'm going to have you sit up. I'm gonna check for position, so close your eyes. I'm gonna move your finger. Did I move it to the right or to the left?
To the right.
What about now?
To the left.
So he's able to detect movements, which is intact. Again, I'm gonna have you close your eyes. I'm gonna give him a familiar object and put it in his hand. We're checking for stereognosis. What is that object?
A key.
Beautiful. He is able to correctly identify the object. He has no deficits there. And then finally, keep your eyes closed. I'm going to draw a number in your palm. Can you tell me what it is?
A 6.
Beautiful. So he has 0 sensory loss. That is testing for graphesthesia. Finally, we're going to check for reflexes. I'm going to use my pen light as my reflex hammer. I'm going to just hit right above for the triflex reflex. Strike the tendon just above his elbow. We see a little bit of a response, which is a +2 average reflex. I'm going to do this bilaterally. Beautiful. All right, one more time, I'm going to have you lay down. We're going to look for the plantar reflex. I'm going to stroke the bottom of his foot. We see that when I do that, his toes curl and they do not fan out, which is a normal response. You can go ahead and sit up. And that is the end of our head to toe assessment. Thank you.
Thank you.